Hey everyone, I just want to talk a little bit today about another thing that is very common with low back pain. So, recall in my last video, I talked a bit about degenerative disc disease and just kind of discussed how these findings are many times used to explain the reason for a person's low back pain. And my discussion revolved around the fact that that conclusion is on pretty shaky grounds, given that so many people without pain have the same findings, and that those findings may actually just be a normal response to aging, and does not necessarily mean or does not necessarily represent the cause of the back pain that you may or may not be experiencing. Another thing that comes up very often when I'm working with my patients is that they have had an MRI and it has shown bulging discs. So bulging discs, I would say, fall in the same category as degenerative disc disease does. In some cases, bulging disc is probably pretty relevant, and I'll discuss a little bit about when that is a little bit later. But in many cases, bulging discs or herniated discs are seen on MRI. And when we look at the studies that are done on individuals without any back pain, again, what we find is that anywhere from 28 to 76% of people without back pain will show a disc herniation on their imaging. So again, probably not the total cause of people with back pain, probably for sure without back pain. People with leg pain, sometimes the disc herniation can be relevant for the patient's symptoms. So when is it relevant? When am I concerned about a person's bulging disc? So if a patient has specific leg pain, maybe even some numbness and tingling, and the area of that pain and numbness and tingling correlates with what is found on MRI, that might be pretty significant. That disc, we could probably say, is probably contributing to patient's symptoms. Okay? Now, the clear thing that we need to understand is that despite the fact that the disc may be contributing to those patient's symptoms, the evidence shows that many times the symptoms can be improved without the need for surgery, without the need for lumbar injections, and that with the right treatment, with the right exercises, with the right mindset on staying active, the symptoms in the leg can resolve. I spoke about this in an earlier video in which I had sciatica pain, likely from a disc problem, that resolved. So, you know, what most researchers and clinicians are promoting now is that even in the presence of leg pain, people with diagnosed disc herniations should undergo a trial of conservative care before doing anything else. Now, there are, of course, exceptions. If a person is not improving after 8 to 12 weeks, you know, surgery may be considered. If there is some significant muscle weakness that does not seem to be improving with conservative care, surgery may be indicated. If you have a sudden onset of balance problems, you probably should be seen sooner for surgical consultation, or if you start to have difficulty with bowel or bladder function, these would all indicate that a surgery might be the best route to go. But those instances are very rare. And as I've stated before, back pain by itself without leg pain, the disc involvement is likely pretty irrelevant, and most people with back pain can be helped with good quality conservative care. Even in the presence of leg symptoms, lower extremity symptoms, pain, numbness, or tingling, these can be managed conservatively, and conservative care consisting of quality physical therapy should be the first intervention to work at decreasing these symptoms. I've helped a lot of people with disc herniation diagnoses, help eliminate their leg symptoms and their back symptoms so that they can get back to doing the things that they enjoy. Again, if you have any questions or want to talk to me specifically about your problem, if you've been diagnosed with disc bulges or disc herniations, feel free to contact me. I'd be more than happy to talk with you. Thanks.